In 1967, Asberg first described acute respiratory distress syndrome, a severe lung condition characterized by inflammation and fluid accumulation, published in The Lancet. Initially referred to as shock lung or wet lung, associated with sepsis, trauma, and aspiration pneumonia. The complex pathophysiology of ARDS involving inflammatory mediators, endothelial injury and alveolar damage was elucidated in the 1980s. Researchers used acute respiratory distress, bilateral lung infiltrates on chest X-ray and impaired oxygenation to identify ARDS over the next decade. In 1994, the American-European Consensus Conference first defined ARDS to broaden the understanding of this syndrome. During this decade, lung protective ventilation strategies to mitigate ventilator-induced lung injury also came up. From 2000 to 2010, several clinical trials highlighted the intricacy of ARDS and the importance of focus strategies including corticosteroids, nitric oxide, surfactants, and other anti-inflammatory agents with varied results. In 2012, the Berlin definition enhanced the precision of accuracy of ARDS diagnosis to facilitate research and clinical trials and gave way to more precise treatment approaches. A fresh period of optimism began in 2020 when the COVID-19 pandemic brought attention to phenotypes of ARDS and studies finding beneficial role of immunomodulators, mesenchymal stem cell therapy and cutting-edge ventilation techniques. Ventilatory strategies have kept on evolving, with lung protective ventilation being the foundation. But research is exploring new ways to improve care for this complex syndrome. The key advances in mechanical ventilation over last 3 decades are the low tidal volume ventilation with individualized PEEP, using of driving pressure, recruitment maneuvers, prone positioning, extracorporeal membrane oxygenation, high-frequency oscillatory ventilation. The future is dedicated to the development of a personalized approach incorporating genetic information, phenotypic variation, biomarkers, and individualized ventilation and treatment. And finally, we have the new global definition of ARDS in 2023, but we still have miles to go. The pioneers in ARDS research are Dr. Luciano Gattinoni, whose work on lung protective ventilation strategies revolutionized ARDS management; Dr. Lauren Brockhard, focused on the optimization of ventilator settings and the lung recruitment maneuvers; Dr. Arthur Slutsky, Dr. John Marini, and Dr. Leonard D. Hudson helped us understand the ARDS pathophysiology. Dr. Gordon R. Bernard established the superiority of low tidal volume ventilation. Dr. Michael Mathai focused on the molecular mechanisms of acute lung injury. Dr. Claude Gurin and Dr. Jean-Jacques Ruby came up with prone positioning in severe ARDS and non-invasive ventilation. Dr. Warren Zapol and Dr. Marco Ranieri pioneered extracorporeal membrane oxygenation application in severe ARDS. Dr. Roger Bone, Dr. Caroline S. Calfee, and Dr. Giacomo Grasselli all focused on the role of inflammation and endothelial injury in ARDS pathogenesis and phenotyping ARDS. Dr. Niall Ferguson explored the role of biomarkers in ARDS. Dr. Margaret Herridge worked on the long-term outcomes in ARDS survivors. We invite you to celebrate the debut of World ARDS Day in India as we commemorate this significant milestone. Attend this exclusive event and witness the making of history as leading experts convene to illuminate ARDS. Don't miss the opportunity to explore the world of ARDS with global leaders and experts in Delhi.